Welcome to this explainer. If you, or maybe someone you know, has struggled with the frustrating maze of PCOS and PCOD, you know exactly how overwhelming the information out there can be. Today, we're acting as integrative detectives. We're going to bring together the absolute best of two entirely different medical paradigms to give you a crystal clear, actionable understanding of what's literally going on inside your body. Here's our roadmap for today. We'll look at what are PCOD and PCOS, uncovering the root causes, spotting the warning signs, how it's diagnosed, integrative treatments, and finally, we'll be shattering some of the biggest myths. Let's jump right into section 1. What are PCOD and PCOS? You know, you hear these acronyms thrown around interchangeably all the time, right? But they are actually quite different. PCOD, or polycystic ovarian disease, is generally an older term for a milder morphological variant. Basically, the ovaries produce immature or partially mature eggs that eventually turn into cysts. It's often highly manageable with just some basic diet and lifestyle tweaks. PCOS, or polycystic ovary syndrome, on the other hand, that's a much broader full-body metabolic and endocrine disorder. It involves higher levels of androgens, those are male hormones, along with insulin issues, and it definitely carries significantly higher long-term health risks. So if PCOS isn't just a simple ovary issue, what exactly is happening inside the body to cause all this disruption? Normally, a follicle grows, an egg matures, and boom, ovulation happens. But in this condition, that natural, beautiful rhythm is completely broken. Which brings us to section 2, uncovering the root causes. Let's look at this vicious cycle from a modern medical perspective. It almost always kicks off with insulin resistance, meaning your body cells just stop responding to insulin the way they should. To compensate, your body thinks, okay, I'll just pump out even more insulin. This massive surge essentially forces your ovaries into overdrive, making them produce excess androgens. And ultimately, those high androgens derail your ovulation, leading to irregular periods and, well, all those incredibly frustrating symptoms. Now, here is where it gets absolutely fascinating. Ancient Ayurvedic wisdom describes a strikingly similar physiological traffic jam, thousands of years before modern endocrinology even existed. It starts with a weak digestive fire, which they call Agni. When your digestion is weak, your body creates this toxic, sticky residue known as ama. This ama literally accumulates and physically blocks the bodily channels, the Srotas, specifically obstructing the reproductive system. The overlap between these two paradigms is just mind-blowing. Whether modern medicine calls it insulin resistance and low-grade inflammation, or Ayurveda calls it weak Agni and ama, both systems have zeroed in on the exact same profound metabolic blockage. And what about the triggers? Well, modern science blames genetics and a sedentary lifestyle, while Ayurveda points to mithyachar, which basically means an improper diet, heavy processed foods, and irregular sleep. Thousands of years apart, and they diagnose the exact same root cause. How wild is that? Moving on to section 3, spotting the warning signs. If you've ever felt like your symptoms are just all over the place, it's because PCOS presents this massive, wildly frustrating range of early warning signs, often starting as early as your late teens. We're talking irregular or entirely missed periods, stubborn cystic acne, especially popping up along the jawline or back, and serious difficulty losing weight, particularly around the belly. You might also notice excess facial or body hair, dark velvety patches of skin on your neck or armpits, that's called acanthosis nigricans, and honestly, just debilitating fatigue and mood swings. Now, Ayurveda expertly maps these incredibly frustrating symptoms to the 3 doshas, Vata, Pitta, and Kapha. For instance, a Vata-dominant patient might experience highly irregular, painful periods right alongside anxiety and insomnia. A Pitta-dominant patient, they might face heavy bleeding, stubborn oily acne, and irritability. Meanwhile, a Kapha-dominant case often presents with excessive bleeding after long gaps, significant weight gain, and intense lethargy. This perfectly explains why no two PCOS patients look exactly alike. It's totally individualized. So how do we figure this out? Section 4, how is it diagnosed? Doctors actually rely on a global medical standard known as the Rotterdam criteria. To get an official PCOS diagnosis, you don't need to check every single box. You simply need to have at least 2 of these 3 specific signs: irregular or absent ovulation, physical or biochemical signs of high androgens, or polycystic ovaries clearly visible on an ultrasound. To confirm those criteria, doctors are going to run comprehensive investigations. They'll look at hormone blood tests, often finding a high LH to FSH ratio, elevated testosterone, and a high anti-Müllerian hormone, or AMH. They're also going to check metabolic markers, things like fasting insulin, glucose, and your lipid profile. Finally, they'll use a pelvic ultrasound to look for that classic string of pearls appearance. It sounds pretty, but it's actually multiple small immature follicles resting on the ovaries. But here is the grand reveal. Despite this unified medical diagnosis under the Rotterdam criteria, is PCOS really just one single disease? Not at all. Patients generally fall into one of 4 distinct functional categories, which brilliantly illustrates exactly why your treatment has to be highly personalized. First up, there's insulin-resistant PCOS. This is the most common type, totally driven by weight gain and high insulin. Second is lean PCOS. Third is inflammatory PCOS, which is characterized by gut issues, chronic fatigue, and autoimmune tendencies. And fourth is adrenal PCOS, heavily driven by stress, high DHES, and anxiety. Let's take a closer look at lean PCOS for a second. This specific subtype completely shatters the widespread assumption that you absolutely must be overweight to struggle with this condition. You can have a completely normal or even low body weight and still suffer from severe hormonal imbalances, irregular periods, and high androgens. It just goes to prove that PCOS is a profound metabolic issue, not just a weight issue. Let's talk solutions. Section 5, integrative and holistic treatments. While modern medicine uses targeted pharmaceutical tools like oral contraceptives to force a cycle, metformin to manage insulin resistance, or spironolactone to block androgens for acne, Ayurveda takes a much more systemic route. It utilizes deep detoxification therapies like panchakarma to clear out that toxic ama we talked about earlier. This is done alongside powerful herbs like shatavari to naturally support your hormones and ashoka to help regulate the menstrual cycle. However, the absolute most crucial overlap between both of these disciplines, the one thing they both agree is the ultimate foundation of healing, is lifestyle modification. Modern medicine notes that losing just 5 to 10% of your body weight can completely restore natural ovulation. That means adopting a low-glycemic, high-fiber diet, which Ayurveda calls ahara. It means getting in 150 to 300 minutes of exercise a week, maybe incorporating specific yoga poses to support pelvic circulation. And critically, it means 7 to 8 hours of consistent, high-quality sleep every single night to balance your cortisol and insulin. Therefore, the most effective strategy is an integrative approach. Step 1, start with a clear, evidence-based medical diagnosis so you know exactly what functional type you're dealing with. Step 2, implement sustainable daily diet and sleep habits as your absolute non-negotiable foundation. And Step 3, layer in supervised treatments as needed, whether that means modern pharmaceuticals to kickstart your metabolism or Ayurvedic herbs to gently guide your body back into rhythm. Finally, Section 6, shattering the biggest myths. Please hear this clearly, because it's so important. A PCOS diagnosis does not mean you're going to be infertile forever. Many women go on to conceive naturally once they manage their underlying insulin and lifestyle factors. And secondly, this is absolutely not just a localized ovary problem. It is a full-body metabolic, inflammatory, and psychological disorder. The ovaries are really just the victims of a system-wide traffic jam.
Ultimately, true healing doesn't come from a quick fix. It's not about detox teas or extreme crash diets. It really comes down to sustainable, integrative habits. You absolutely have the power to break this cycle by improving your sleep, managing your stress, and getting regular movement. So armed with this unified knowledge from modern science and ancient Ayurveda, which holistic change are you going to take control of today?